vividly remember one of the first interactions I had in the hospitals as a researcher was a surgeon who said, just give me the same teams over and over again and we won't have teamwork challenges. So I've studied teams and organizations for close to 20 years. Within the last 6 or 7 years, I've become really interested in and involved in healthcare teams. So surgical teams and labor and delivery teams. Those are the biggest risk areas for a hospital, especially surgical suites are the costliest real estate within a hospital. About $62 per minute is how much it costs to run a surgical suite. So hospitals are looking to try to make their surgical teams as efficient as possible, and teamwork plays a key role in that. And so that was really the research question, is putting a team together on a continual basis, shared team experience as we called it in the paper, is that actually valuable? Because there could be benefits of it, but there could be detriments of having the same team over and over again. And we talked about in the paper, complacency could be the primary driver of some of those negative effects. And we found some contradictory results in our study, right? That complacency, this having us work together time and time again, does bear itself in the surgical suite. And so we looked at archival records of how often these surgical teams had worked together. And over time, there are some negative effects, primarily if they are surgeries we do a lot within our hospital setting. So for example, if it's a hip replacement and we're a facility that does a lot of hip replacements, that complacency effect, the negative effect of having us work together as a team becomes even more magnified, as opposed to we work together a lot in the past, but it's a procedure we've not done a lot within this hospital. It's a novel procedure. That negative effect actually doesn't happen. That's when the positive effect of us working together as a team really starts to bear itself out. We quantified in the paper that even a 3% increase in surgical efficiency in that particular facility equates to about a $2 million increase in dollars for that hospital. Making small changes over time, I think, is the way to really chip away at and get the ultimate rewards your organization might want. And I think team and team dynamics are a factor in that, right? And so in teams, if you see, and I've got other work that looks at interventions you need to make in teams, regardless of whether it's hospital or not. And there are lots of interventions you can make to improve team effectiveness, but it's probably not a one size fits all. You need to understand what are the root cause problems of my team challenges, and then diagnose that and give an intervention to the root problem, as opposed to a one-size-fits-all type of model to try to improve team effectiveness. You have to understand the nuances of the team, and I think that's what we found with this study, is you have to understand the nuances of the surgical team to know if we make this change in composition on this type of procedure, we may or may not get the rewards we were striving for.